My name is Jeffrey Roberts, and I'm the co-founder of Tuesday Night IBS and founder of IBS Patient Support Group and World IBS Day. I'm thrilled to welcome all of you tonight to our webinar series. Tonight, we have an opportunity to hear from an outstanding gastroenterologist and scientist, Dr. Brennan Spiegel, Dr. Megan Riehl, a clinical GI psychologist who works with patients with digestive diseases, and Kate Scarlata, a GI dietitian who has focused her clinical activities on IBS patients and diet. Tonight's independent medical educational webinar was supported by Ardelyx. So let's go ahead and introduce them. Dr. Brennan Spiegel is a gastroenterologist, professor, and storyteller whose work lives at the intersection of science, technology, and what it means to be human. He directs health services research at Cedars-Sinai, where he holds the George and Dorothy Gurich Chair in Digital Health Ethics. He also leads the master's degree program in health system science and oversees the Center for Virtual Medicine and Health System Innovation, a multidisciplinary group that designs and tests digital tools to improve the delivery of medical care. He has published more than 300 peer-reviewed papers, including studies in Annals of Internal Medicine, Nature Digital Medicine, JAMA Network Open, and JAMA Surgery, and authored 8 medical textbooks. He published the book VRX, How Immersive Therapeutics Will Revolutionize Medicine, which explores how virtual reality and AI can support healing. Most recently, he published Pull, How Gravity Shapes Your Body, steadies the mind, and guides our health, which introduces the field of biogravitational medicine. He is founding editor of the Journal of Medical Extended Reality and is the past editor-in-chief of the American Journal of Gastroenterology. His research has been funded by NIH, the Robert Wood Johnson Foundation, and the state of California. Dr. Spiegel was one of the first group of clinical researchers to examine the gastrointestinal manifestations of COVID-19. Dr. Spiegel earned his medical degree from New York Medical College and his master's from the UCLA Fielding School of Public Health. He completed his residency in internal medicine at Cedars-Sinai and his gastroenterology fellowship at UCLA Medical Center. Dr. Spiegel lives in Los Angeles, and it's a great honor to have Dr. Spiegel with us tonight. Dr. Megan Riehl is a health psychologist and associate professor of medicine at the University of Michigan, where she is the director of GI behavioral health. In her clinical practice, she offers state-of-the-art care to those with digestive conditions. Dr. Riehl participates in several national committees dedicated to enhancing the social functioning of people with GI disorders. Her research and clinical expertise have led to several peer-reviewed publications, medical consultations, and international lectures. Dr. Riehl's new book, co-authored with Kate Scarlata, called Mind Your Gut, was published in 2024. Additionally, Dr. Riehl and Kate's podcast, called The Gut Health, features in-depth topics surrounding IBS and digital health. Welcome back to Tuesday Night IBS, Dr. Riehl. Kate Scarlata is a Boston-based GI expert and registered dietitian with over 3 decades of clinical experience. Her primary area of expertise is in the role of food intolerance in GI conditions. Kate has made significant contributions to the GI nutrition field with her clinical expertise, research, and insightful presentations at national and international meetings. Kate and Dr. Riehl have explored the topic of gravity on their podcast with Dr. Spiegel, and that's what encouraged us to continue this conversation on Tuesday Night IBS. So welcome Dr. Brennan, Dr. Riehl, and Kate to Tuesday Night IBS. I will now turn it over to Dr. Brennan to get started, and Dr. Riehl and Kate will join the discussion.
Okay. Well, thank you so much for that kind introduction and for the opportunity to be with you all today. I'm going to bring some slides up and introduce this topic. And as I go through this, I'm going to present 3 cases, actually, patients who I've seen, and talk about how the role of gravity itself affects the way I manage these individuals. So let me get my slides up, and we will get started. Make sure everything's up and running. Okay, and you guys can see that. Great. So as you heard, I've written a few books, and a lot of what I'll be talking about today is based upon this new book called Pull, How Gravity Shapes Your Body, Steadies the Mind, and Guides Our Health. And, I'm a gastroenterologist, so a lot of my interest is about the gut, but also the brain-gut interaction, and also how the gut informs the rest of the body. Hippocrates said all the way back in, I think, 350 BC that all disease begins in the gut. That's what he said. Now, I don't know if that's quite right, but there's some truth to that too. But what we'll talk about today is a lot of disease begins with your relationship to gravity. And that's maybe the surprising piece of this discussion. We don't think a lot about gravity because it's all we know from the moment we're conceived to our final breath, we are being pulled down onto this planet that we're all born into. But if you think about it, our relationship to gravity is almost like a fish and their relationship to water. A fish is designed to survive and thrive by moving through water. It probably doesn't even know it's in water. It's all it ever knows. Turns out we are designed to survive and thrive in a gravitational field. Gravity was here first. Physics came first. And biology came second. So when we look at our bodies, every part of our bodies, the pumps and tubes on the inside, the muscles and bones, but even the nervous system and the brain and our moods and emotions that come out of having a body, every single part of it evolved to manage this force of gravity. So that's what we're going to talk about, and that may seem very sort of poetic or impractical, but it turns out there's some very practical applications for knowing this, and that's what I'm going to talk about today. Now, just to give you a little background about why a gastroenterologist like me would get interested in gravity at all, it actually started several years ago when my mother-in-law had developed some cognitive decline, and she was living in an assisted living facility, and she started spending a lot of time lying flat in bed, like this picture here. And about that same time, she started developing abdominal bloating and slow digestion and depression. And she hadn't changed her medications. She really hadn't changed her diet. And my family was asking me, what do you think is going on? And I thought, boy, I don't know, but she has changed her relationship to gravity. We are not designed to lie flat all the time. We lie flat when we're sleeping, which is a very interesting reason for that we could talk about. But then we're supposed to get up and move and engage with the world. And when we stand up, as I'll show you, our guts hang down. And things can go wrong if we're not in good balance physically and literally with the force of gravity. So that got me thinking, and I ended up writing a paper called Gravity and the Gut that was published in the American Journal of Gastroenterology, and that ended up turning into this whole book. So let me just give some background, and we'll jump into some specific cases. If you think about the human body, we evolved through these stages shown here. And for most of our evolutionary history, we were not upright. We were four-legged creatures. And in this position, gravity was pulling down against the spine, and our organs were dangling off of this more diagonally oriented spine than what we have now, almost like ornaments hanging off a Christmas tree. And as we started to stand up, which just happened in the very end of our evolutionary history, that ornament started pulling itself up and against our spine. And that put a lot of pressure on the lower back. That put a lot of pressure on our nervous system to stay upright and stable, and to the gut that's hanging down in the middle of that, which is almost like this weighted ballast that we have to carry around. And I'm going to get into the details of just how we do that and what can go wrong when we have difficulty managing that force. But if you think even beyond the gut, gravity intolerance is the basis for most of the chronic diseases that we manage. What is lower back pain, if not a form of gravity intolerance? What is ankle swelling or heart failure or venous insufficiency, if not a form of gravity intolerance, where gravity is pulling the fluid down into the ankles? And when our spine doesn't work and we bend forward, there's a condition called kyphosis, for example. And look what happens in the gut. When we bend over all the time, it actually compresses the abdominal cavity. And this is a picture of a patient that I saw with bloating. And you can see in part that the bloating is related to this gravitational effect of the lungs and the chest just compressing down into the belly. Even if we think about more common things like heartburn and acid reflux, this is a gravitational effect too. We tell our patients, for example, who have nighttime heartburn, that you probably shouldn't sleep completely flat. It's better to sleep on a wedge pillow or to lift the head of the bed, or to sleep on your left side. These are all maneuvers that change your relationship to gravity and help reduce acid reflux symptoms. Think about even going to the bathroom and managing constipation. We know that the so-called squatty potty is actually quite effective at helping people change the angulation of their anus and rectum so that bowel movements can fall out a little bit easier in partnership with the force of gravity. So again, it's not too surprising that our relationship to gravity matters. What is surprising, as you'll see, is just how deep it goes and how easily we can address it, as we'll see through diet, which is why Kate is with us, through psychological interventions, which is why Megan was with us, and with a number of other medical interventions that we'll talk about. Now, it turns out there's something that I like to call the gravity Goldilocks zone, and it looks something like this, where you can have too much or too little gravity, and this can cause problems with your health. So on the one hand, if we have too much pull on our body, then we get backaches, we get pain, we might get stomach aches, as I'll show you, we might get ankle swelling. But then there's also the other side, high altitude living. Some people get jet belly up in the upper atmosphere. Astronauts, where they have microgravity, get lots of issues. Even our microbiome, the trillions of organisms that live in our body, they also respond to gravitational forces, which is quite amazing. So what I like to say is, on planet Earth, gravity doesn't really change, but our relationship to gravity does. As we get older, we might gain weight. We might become weaker. We might not eat the right things, and our spines start to bend, and we can start to really suffer if we don't stand up and fight the force of gravity. So with that in mind, let me tell you about a case who I saw not too long ago. This was a 26-year-old woman who came to see me in the clinic with lots of bloating, and she said that her abdomen felt swollen and distended, like I looked pregnant, she told me, by the end of the day. And she described abdominal tension and gassiness and fullness even after small meals. And she had carried a diagnosis of irritable bowel syndrome for years because of this history of diarrhea and constipation. Now, I went in to shake her hand and I greeted her. And as I shook her hand, I noticed that her wrist felt unusually clicky. It actually clicked, almost like her joint was slightly dislocating as I shook her hand. And you may have noticed this from time to time when you shake somebody's hand, you feel a click in their wrist. You may not really think much about it, but as a doctor, that's a first clinical clue. And you might ask yourself, what is going on here? And what might this have anything to do with gravity, of all things? So I want to start with this case because it's actually quite instructive about how to start thinking about gravity and the gut. Because this patient, as I asked her more questions, it was revealed that she had very stretchy joints. So when I asked her to pull back her pinky, it went way back. When I asked her, could she take her thumb and touch her forearm, she was easily able to do that. Now, I can't do that at all. She was double jointed in her elbows. She could touch the ground without bending her knees. Curious, do any of our panelists know what's going on here? Does this sound familiar to anybody? Yeah? Okay. Yeah. Okay. So Erica, yes, is demonstrating this. And this is actually what it looks like when you look up close, is the ability to stretch the thumb all the way down to the forearm. Now, no one had done this before with this particular individual. It had never been tested. Now, the question is, what does this have to do with gravity? Well, this is probably a form of Ehlers-Danlos syndrome, or EDS. It may not truly be Ehlers-Danlos syndrome, but there's definitely this what we call hypermobility of the joints. That means the joints are very stretchy. And when the joints are stretchy, it turns out the inside can be stretchy too. And when you stand up and gravity pulls down the sack of potatoes that we've all got in our belly, there are suspension cables basically that hold it up. And if those suspension cables are overly stretchy, then that sack of potatoes can compress and fall down into the pelvis. And I want to show you a picture of this patient. Here is a picture that I took, or the radiologist took, called a small bowel follow-through, where you swallow some barium. And first, she is lying flat. And I want you to just notice, compared to what happens when she stood up. So on this side, the stomach is round. The intestines are all laid out in the middle of the abdomen. You can see right about here is called the iliac crest. And for comparison, here it is on the right. Compared to what happened when she stands up, almost 90% of the bowels collapsed into the pelvis. Gravity took over. Gravity pulled the intestinal system down because of the stretchiness inside of the abdominal cavity. And so you can very easily see that this is a form of gravity intolerance. Now, I'm not saying that everyone with IBS has this, not at all. But I am saying that everybody with IBS should have their joints checked for hypermobility. And that's almost never done, actually, almost never. So if we look at what's happening in the belly, gravity pulls that sack of potatoes down. But there are a few systems that we have to help manage this. The first is called the mesentery. This is the suspension cables that the ornaments are basically dangling off of. And they all connect right about L3, L4, which means your back is very important. It's interesting that so many people with IBS also have back pain. Very common. Well, the back has to be strong, almost, ramrod straight, the so-called anti-gravity extensor muscles on your back that pull up if you're standing up straight with your shoulders back, diaphragm up, it pulls up the sack of potatoes. And there's a sealing mount up here. The diaphragm and the falciform ligament, it's called, are like a sealing tack holding the whole system up. And then there's the abs. The abdominal wall, we're going to get into each of these briefly, is like a bolster that keeps everything tight. If that system is weak, if the back is weak, what happens is the sack of potatoes drops and it compresses. And it's a lot like this picture. We have basically a crane going on in our body. And each part of the crane has an anatomic analog. So you can see in this case that what's going on is we're trying to pull that sack of potatoes up, but the cable's too stretchy because this particular individual has Ehlers-Danlos syndrome, and that leads to the sac compressing down. Now, these are some studies that look at the overlap between irritable bowel syndrome and this form of hypermobile Ehlers-Danlos syndrome. And in one thing, by the way, you can notice is the skin can be stretchy too. And in one study, they found that 49% of patients in a referral center had evidence of joint hypermobility. So they have gravity intolerance, or a so-called allergy to gravity is sometimes the term that is used. So one thing I want to emphasize, though, is Ehlers-Danlos syndrome often overlaps with a condition called POTS, postural tachycardia syndrome. You may have heard of this. This is a condition where people get very lightheaded very easily when they stand up quickly. And that also overlaps with irritable bowel syndrome. So there is this triumvirate, like a triad of three conditions that are particularly sensitive to gravity, standing up too quickly, getting lightheaded, having stretchiness of the joints. And the question is IBS itself a form of gravity intolerance in some people? And that's what I'll talk a bit more about. But one thing these three conditions have in common is a problem with these tiny little sensors that we all have in our aorta and in our carotid. They're called baroreceptors. And baroreceptors are tiny sensors that are constantly checking your blood pressure. And if they're too sensitive, your blood pressure can drop easily. And then you get a heart rate that starts to go quickly. And people can even feel panicked. Their nervous system fires off. And it turns out all three of these conditions, including IBS, are strongly associated with baroreceptor issues. which in fact, if you look at it fundamentally, is a problem with gravity tolerance. That's basically what we're talking about. And it's interesting because some of my patients send me pictures like this, where they will flip themselves upside down and feel better. They feel the blood rushing to their head. They feel their gut like relaxing. And they're not going to do it all day, but it's almost like sort of flipping yourself around a little bit to move, the food through the system, to let the pumps and tubes get reestablished in relationship to gravity. And this is something the patients tell me work. I never learned about anything like this in medical school. I will stop for a second. I'm curious for many of our panelists here, if you've heard of people doing this for any purpose, or if you've had any experience yourself with doing these kinds of tilt table exercises.
I've definitely seen patients benefit from different yoga poses and, standing on their heads and doing different movements that way. I haven't had any experience with the tilt table. But I do think this is very interesting, and it's a little bit of a side. You were talking about hypermobility and POTS, and what do you think? This is a little bit going aside, but just the MCAS relationship, because we're seeing so much of that being the triad or the trifecta. How does that fit in to this story?
So MCAS is a mast cell activation syndrome, and mast cells release many different chemicals, including histamine. And histamine itself can drop your blood pressure and cause you to vasodilate, it's called. And then the blood pressure drops. So in a way, that's a form of gravity intolerance too, because it can promote this orthostatic hypotension that you see in POTS, where if you have too much histamine, it causes your blood pressure to drop, you get lightheaded. It also can cause stomach ulcers too, having too much histamine, which is why we use histamine blockers like cimetidine, famotidine. These medicines are histamine blockers. So it really gets all throughout the body, the way it works. Yeah.
Yeah, it's interesting because, mast cells and IBS have been connected too,
Yes. Yes.
So, okay, just a little.
Yeah, there's research originally, I think, from Barbara in Italy, looking at mast cells in the intestines. When you take biopsies, there's some studies that show more mast cells, particularly around nerves, in the biopsies of people who have irritable bowel syndrome. Yeah, definitely. Okay, cool. And you mentioned yoga, and this is another inversion that can help bring your relationship to gravity so that the brain perfuses the thyroid, the upper head and neck, and there's a lot of research that this can be also quite helpful. And the so-called anti-gravity yoga, where you can kind of hang out in a hanging fabric. The zero gravity chair, which was developed by NASA to help you kind of lean back and kind of change your relationship to gravity. And swimming in particular is good for Ehlers-Danlos and in general, because it is a horizontal activity as opposed to a vertical activity if you're running and you're constantly like stretching that mesentery. And it's also clear that swimming is very good for the microbiome. There's evidence that it can help improve the diversity of the microbiome. And we're going to come back to the microbiome because we have to with Kate here and with diet. We're going to talk a bit more about that and what diet can do for that, for gravity tolerance. And I'm going to hold that for a second. But these are some other thoughts. So let me jump to the second case, and then I'll do one more after that. And we'll have a lot more to talk about as we get farther along here. So here's a person who's 56 who has a body mass index of 34, which is on the bigger side. 35 or greater is considered so-called morbid obesity. So some extra body weight, who has chronic bloating. She says she has fullness and constipation. Her history is notable for lower back pain and depression. She works as an office clerk. She spends most of her days sitting, and she does not exercise. On exam, she is obese. She appears bent forward at the upper spine. So she has that kyphosis that I described before in that x-ray picture. She does take intermittent Vicodin for pain. And a recent screening colonoscopy was normal. And she's had a bunch of lab studies, including looking for celiac disease, for inflammatory bowel disease, for anemia. They've all been normal. So what would gravity have to do with this case? And I'll tell you how I think about a situation like this. of course, I'm going to think about all those other conditions, but I also need to think back to this picture that I showed you earlier. So in the last case, I talked about the suspension cable and how that could be stretchy, but that's not all that common, right? It's it happens. But you know what's much more common is just the boom of the crane itself can become weak. The support cables, the counterweights, what we're calling the spinal column here, right, can start to break down. And take a look at this picture. This is a picture of the abdominal cavity, anatomic picture, and take a look at how close the spine is compared to the rest of the body. You know, in gastroenterology, we're all focused on the gut, but we're not thinking a lot about the spine. But if you look at the gut hanging like ornaments, it's actually all connecting right about at L4. And you can almost imagine like this sack of potatoes is being suspended up by that spine. If your spine is weak, if it is curved too much, if you have weak back, weak abs, which we'll talk about, weak diaphragm, it starts to compress, as I showed you earlier, the abdominal cavity. And not only does it affect the physical space, but it affects the movement, the so-called motility. This is a study looking at the impact of just having a bent spine in older individuals on their myoelectric activity, which means literally if you measure the movement of the gut, it slows down as the gut gets more and more compressed. Now just think about so many of us who are sitting around all day. Now I'm at a standing desk right now on purpose, and I'm going to come back to that because standing is good for the gut. When you stand up straight, shoulders back, diaphragm up, you literally pull up the abdominal cavity. It's almost like a marionette on strings. If you let the marionette pull up, you can animate it and move it. But if you move down, you let your hands down, the marionette collapses at the bottom. And you think about all of human history. We weren't in rooms like this. We weren't surrounded by drywall with, fluorescent light around us. We were outside farming, hunting, working the land, fighting for our survival, literally every day standing up and engaging with gravity. And now we don't do that as much, and it affects our gut. Absolutely. And it's maybe not surprising then that some of the most effective therapies for IBS are about fighting gravity, physical activity, osteopathic manipulative therapies, Tai Chi, all these sorts of things not only help you feel better, but they literally speed up your colonic transit time. They literally make your colon move faster if you are able to stand up and be strong. So this is very fundamental, basic stuff. Losing weight as much as you can, easier said than done. Getting strong, working out. And this is what I do. So this is literally where I am right now. And this is my office. I call this Operation Gravitate. And what I did for the book that I wrote is I did an experiment. For 8 weeks, I wore a weighted vest. I have a standing desk, a desk stepper, and a balance board and ankle weights. And I was simulating life on a planet with greater gravitational pull. And so today wrote a nice little article about this and what I do to wear these weighted vests. And in the book, you can check it out. I write all about, and this is a little QR code if you want to check out the story that I wrote. I talk about what happened. I literally lost weight without exercising anything anymore. I lost about 4 pounds. And that's because we have something called a gravitastat in our body, like a homeostat for gravity. When you feel extra weight all of a sudden, the bones feel the pressure and they increase metabolism in your body. It's the opposite of what happens to astronauts. They feel no gravity and they start to get osteoporosis very quickly. They have to work out like crazy in space in order to stay fit at all. We can do this on ground. Now, you got to be careful. Don't overdo it. The weighted vest, you can work your way up. The one I use has little pockets in it. And I actually wear it throughout the day. I'm not wearing it right now, but I have my weighted vest right here, so I probably should have it on. And I keep it nearby. And it's a great way to just strengthen your body. Dead hangs are also another good way to think about doing things. You hang for as long as you can every day. See if you can hang longer and longer. It teaches you how to open up your gut and strengthen your back. And then there's the abdominal wall. We didn't talk about this much yet, but what's going on with the abdominal wall? This is a cartoon from Brian Lacey's research on bloating, and it's been shown that bloating in many cases is actually a gravity problem. What happens is gravity pulls the whole sac down, and if you don't have a strong ab, it has no place to go except pooch out the front. And this is called an abnormal viscerosomatic reflex. And what it actually is amazing about this is people tell me in emails that if they do certain exercises, like so-called hypopressive exercises, it helps with their symptoms. And this is an exercise where you suck in your belly and hold it and then relax. And then suck it in again as if you're pulling a cable and pulling that sack of potatoes up into your chest and relax. And this can actually help with bloating and with lower back pain and with pelvic pain. And that's been shown in various studies. Very exciting study here in the journal Gastroenterology, relatively recent study, randomized controlled trial, people with bloating, where they had two conditions. One was they did nothing, and the other they did biofeedback with abdominal contractions. And what they found is the group with the abdominal feedback had lower scores in bloating compared to those who just used placebo. So if you literally learn how to contract your abdomen correctly while working out with hypopressive exercises or sit-ups, it can help strengthen that sack of potatoes so it doesn't blow out the front. So it's not always about bacterial overgrowth and gas formation. Sometimes it's literally about gravity management. Simple as that. All right, my last case, and here's where I want to get Kate and Megan really involved, because this is going to get into their territory, and I've been doing a lot of talking. This case is the nervous belly. So we're going to hear from Megan here for sure, and Kate, because we're going to talk about some diet. So here's a 28-year-old woman who presents with nervous belly, which she describes as these stomach pangs and fluttering sensations that worsen with stress. She also has loose stool several mornings per week, and her primary care doctor referred her to GI for a colonoscopy because of the diarrhea. Now, the workup includes a normal complete blood count, so there's no anemia, there's no abnormal chemistries, thyroid looks okay, CRP is for inflammation, looking for IBD, that's normal, no celiac signs. Stool calprotectin is a measure of inflammation in the colon, that looks okay, no signs of infection. No red flag symptoms. She's not losing weight. She's not throwing up a lot of blood or terrible things like that. She does have a history of anxiety and panic attacks and palpitations in her chest, skipped heartbeats, vertigo, feeling like she's spinning, describes feeling lightheaded, describes feeling sometimes like she almost is out of her body, like she feels, it's called a depersonalization, almost like she's not even in her body sometimes. And she really worries that this could all be a sign of something bad like cancer. Now, on examination, we don't find anything. She has a normal abdomen, it's soft, non-tender, and so on. All right, I want to ask maybe Megan for starters, not to put you on the spot here, but this is, I'm sure, a kind of person that you see quite a bit, who comes to the stomach doctor, comes to us for abdominal pain, but then we're concerned that she has a lot of other psychosocial comorbidities. Do you have any thoughts about this situation before we kind of jump into the gravity side of this?
Yeah, this is right up my alley. This is certainly a woman that is seeking reassurance, and our anxiety can drive a desire to have that definitive diagnosis, to know what's wrong and to fix it, to make this go away. And there are probably, in my work, I would do an initial consultation with her and really assess from a multi kind of health perspective, asking about, her history with her mental health, her history with her physical health symptoms, asking a little bit about her nutrition, asking a little bit about the behaviors that may or may not be helping her or hindering her. And then coming up with a treatment plan that's focused on decreasing both the physiological experience of her anxiety as well as strategies to navigate the cognitive pieces of the anxiety.
Mm-hmm. Yeah. And Kate, so Megan mentioned going over diet as well. Is there a diet that helps with anxiety? Like, is there some kind of dietary recommendation that's specific to this, or is it more general? What would you be thinking about from a diet standpoint?
From a diet standpoint, I'd be thinking, how can I maybe help the diarrhea? And I would
Mm-hmm.
get a sense of, is this sort of episodic diarrhea where there are differences in her diet? Does she
Mm-hmm.
feel like it's food related? Certainly there is evidence with Mediterranean diet and balancing out a good healthy diet. There's some data looking at ultra processed foods that may be linked with mental health conditions, but it wouldn't be my first thing that I would go for. Obviously, every patient we see, we're looking for well-balanced, good, healthy diet. But I would probably be looking specifically, are there some particular triggers going on with the diarrhea? And then,
Right.
as always, balance out that diet, which may help with mental health.
Yeah,
And this
for
may
sure.
be a patient that's ripe for, she's been restricting, right? So if
Mm.
she's having that morning diarrhea, maybe
Mm-hmm.
she's, eating only at night because she wants to get through her day. And so really assessing for some of the very unfortunately common disordered eating behaviors that we see in this patient population and walking it back to kind of get a better understanding of why she might be engaging in that, educating her on, a longer term goal. I never like to flood a patient that's suffering in this way with, okay, well, you need to be eating 3 times a day and
Right.
1 to 2
Right.
snacks. And, why are you not eating and da, 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 we have to be really thoughtful around. It makes sense if she maybe thinks that food is a contributor to her symptoms. We have to really be thoughtful around our plan for reassessing some of these things that she might be struggling with.
Mm-hmm.
Okay.
Great. Well, great advice. I'm going to come back to you guys as we move through this case, but that's how the three of us are kind of thinking about this. So I see, first of all, I'd say a colonoscopy. No, I don't think we need to do a colonoscopy here. I think we have to really think more broadly in the way we're hearing. But then I have the second question. How could gravity be involved here? Wow. Well, one day I was thinking about how I see so many people who have these gut feelings and, they might get nervous and they feel it in their belly. I get that. I feel that way. If I take a big, exam, or for me, I'm a little afraid of heights. If I'm standing high up and look down, I might get a feeling of wooziness in my belly. I was thinking about this one day and I thought, there's one thing that causes gut feelings in everybody, nervous belly in everybody, and it's falling. It's literally falling. It's a gravity challenge. Think about the last time you were on a roller coaster. You probably felt your belly ignite. Why is that? Why is our belly lighting up when people are on a roller coaster? And look at these two people in this picture on the left. It's like we have a G-force accelerometer in our gut that's telling you that you're at risk. In fact, you may be about to die. Why do we even ride roller coasters? It's to practice our demise. We're not supposed to fall 20 stories and survive. Okay, we do it because we know we're safe and we're okay. But, I will call G-force vigilant because she's screaming, white knuckling. That's the way I tend to ride a roller coaster with my hands knuckled around and it's kind of like, ah! Whereas he's throwing his hands up, throwing caution to the wind. He's G-force tolerant. Even your relationship to gravity on a roller coaster says something about you. If we were to do an MRI scan in their brains, they would look quite different at that moment. Some people don't need to be on a roller coaster, just on an airplane, and you feel that in your belly. In an elevator shaft, and you feel the elevator go down a little bit, you get a feeling in your belly. And by the way, this goes back to when we're born. There's research from the 1960s, and this is a picture of a baby in one of these experiments who you can see is very hesitant to go over the edge of that cliff. Now, it turns out there's a piece of glass so that the baby's safe, And a parent is on the other side of that glass, coaxing the baby to come towards them, but the babies wouldn't move because they were afraid of falling, even if they've never fallen before. We are neurophysiologically designed to stand up and stay up and not fall down. We don't want to fall down. That's how we get hurt. Look at this person on the right in virtual reality. This is something that I've tried. It's absolutely frightening if you try it and you're afraid of heights. You don't even need to be just in a virtual world. Some people get this feeling in their gut. It's an anxiety. It's like a neurovisceral fear of falling. So that's sort of something that got me thinking about the difference of people's relationships to gravity. Look at this guy, famous, Alex Honnold. He is famous for free soloing El Capitan in Yosemite. He manages to get all the way up that cliff. He could die at any nanosecond. Just look at that. But he gets up to the top, survives. He has no gut feelings. He has no part of his body telling him you're about to die. In fact, that's true. They've done functional MRIs of his brain. And there's a part of the brain called the amygdala, which is an emotion center. And his amygdala, compared to a control subject, is basically not there. Now, he does have it, but it barely lights up. When you get gut feelings in your belly on a roller coaster, it's not just about the literal physical fall. It's like your amygdala is a ventriloquist throwing its voice into your belly, telling you that you're about to die and warning you. But some people get that feeling even with the slightest perceived risk. It may not even be a real risk, but it feels as if I am going to fall all the way to my death. And poignantly, when you fall all the way to the ground, in some traditions, you end up in a gravity box called a grave. That's a word that comes from the same word as gravity. Grave is heavy. It's serious. Look at people with IBS in comparison to Alex Honnold. They have the opposite brain in this research by Emran Mayer. The amygdala fires off very easily. You will see this in people with fibromyalgia, with chronic pain. Now, this doesn't mean that IBS is all in your brain. No, it does not mean that. But it does mean that over time, the brain starts to become very, very sensitive to threat detection. And if it fires off with even the slightest feeling, you're going to have gut feelings when somebody doesn't treat you well, or if you feel like you're going to lose your job, or if you're worried about, your child coming home from a late night out and you start feeling it in your stomach. It's almost as if you feel yourself falling. Metaphorically, gravis means heavy. It means serious. Gravity is literally grave. And so you think about even the language that we use. We talk about wishing upon a star, floating up on a cloud, thumbs up over the moon, versus down in the dumps, hanging my head down below, in low spirits. Things are looking down. This is not just a metaphor. It turns out we are neurobiologically, neuropsychologically designed to think that up is good and down is bad. We want to stand up and stay up. When you're high on psychedelics, we talk about being high. Serotonin explodes into your brain, and you literally feel like you're floating. Now, Lachlan Kent is a neuroscientist in Australia. He may even be on this webinar right now. I'm not sure. I could check. And he developed the theory of mental gravity. And he figured out one day that, oh my goodness, depression is like too much gravity on your body. Just think about it. You can't get up out of bed. You're exhausted. You slump your shoulders over. It's a physical experience as much as it is a mental experience. You're looking down at your toes. You don't have the energy to engage with the world. It's like you're being pulled down. Space-time itself, time slows when you're depressed. It's like you're in a mental black hole. Anxiety is like you're falling, and depression is like you've fallen. And that's the theory of mental gravity in a nutshell. And when you ask people to draw their emotions on a body, they will use vertical information. They'll talk about happiness being an upright, floating lightness, and depression is in the limbs. It's heavy. There's a leaden feeling in the body that you can't literally get up. You're pinned down. Now, I'm curious, Megan, how this theory and these kind of pictures on the screen, resonate with your own experience clinically with people experiencing anxiety and depression, and what you think of this.
Yeah, I think, when we were talking about the amygdala and the way it lights up, it's a plug for why our brain gut behavioral therapies work so well is that we're getting more so at the root of the way the brain and the gut are communicating, and helping patients to understand some of that gut feeling that they have is real. That gut feelings are, they are intuition, and we can hone our understanding and benefits of that gut feeling. And then also, at least with the patients that I'm working with, they're not in the best relationship with their gut feelings a lot of the time. And we have to work on that. And helping people to understand, as you said earlier, IBS, for example, is not in your head, but the head does play a role, and that's our brain. And that's that communication pathway between our brain and our gut. And that can be driven by that visceral nerve sensitivity. So that makes you feel those sensations of cramping, spasming, urgency, pain. Those are real. And then how along that brain gut axis and our vagus nerve, it sends signals up, and it's the brain's job to interpret what to do with those signals. And in a lot of patients that are living with GI conditions, the brain amplifies those sensations instead of downregulates them. And so our brain gut behavioral therapies are really helpful in terms of retraining the way the body and the brain are experiencing, whether it be emotions or sensations, to kind of recalibrate. So a lot rings true, and this is a really fun, interesting way of also thinking about our gut feelings.
Yeah. So we're going to come back to a few of these topics, including the vagus nerve here in a second. And definitely we're going to get to serotonin. I'm going to skip this, but I do want to show you this now, because this starts to have implications for how do we manage, gut feelings. And here is a patient named Harmon Clark, who's allowed me to use his image and to say his name, because he's very open about his experiences, and he's now one of our graduate students. It's amazing. And he actually has Crohn's disease, not IBS. But he has recurrent abdominal pain. And in this moment, he is using virtual reality to float up into space and to look back upon the planet. And he says it gives him a sense of awe and wonderment, like he's part of something greater than himself, and this sense of like joy in a way. And he uses this in the hospital instead of opioids whenever he can to help with his pain management. Here, I'm going to show you our two computers, and I'm going to animate this in a second. In this room is another patient with irritable bowel syndrome, IBS, who has IBS with significant abdominal pain and bloating and diarrhea and constipation. And this particular patient, you can't see, has not responded to many different therapies, including antibiotics, tricyclic antidepressants didn't seem to help. She even tried ketamine, which kind of helps in an interesting way, but not a lot. And she lost her son in a car accident 6 months before this video was taken. And what I'm showing you here are two computers. On the left, I'm going to show you her biosensor data, literally how stressed she is, because we're measuring that with biosensors. On the right, you can see what she's seeing in virtual reality. She likes the beach, so we had her float over water. And she watched as this mandala expanded and contracted in lockstep with her breathing. And you have to imagine, for her, she literally feels like she's on a beach, surrounded by this virtual world. Although on the two-dimensional screen, it's hard to tell. And this is her cognitive load. And as soon as we started the floating experience, you can see that she relaxed just immediately. And right about here, she started to cry. And we said, "Are you okay?" She said, "Yeah, I want to stay here." And right about here, about 12 minutes in, she said she was in heaven with her deceased son, which is really quite moving. And, she was crying, and we took the headset off and we said, "Are you okay?" And she said, "Yes." She said, "I feel like I'm floating." She said, "I feel like my nervous system has finally released its grip upon me, and I don't have any pain right now." And she said, "I haven't felt like this in months." And we said, what just happened? I mean, we didn't use any medicine. We didn't inject anything. You did this. You changed the way your brain was experiencing your body in that moment by elevating, metaphysically elevating. And so that's a treatment that we use quite often. And I often will show people this video of the brain. It's called the glass brain. And it shows the higher order networks in the brain. And I say to people, your brain's not like a block of Play-Doh that, rattles around in your skull. It's a shape-shifting organ like any other organ in your body, and your brain just changed. And we didn't cure your IBS, but you did just get a little insight about how you can rearrange, reorient your mental relationship to your body. And if we work on this for 6 weeks, 8 weeks, 12 weeks, you might learn how to do this routinely without needing any virtual reality. And this is really working with experts like Megan, who know how to do cognitive behavioral therapy, which is very effective. And I see it as a form of anti-gravity therapy. And when we actually look at this, it changes cortisol level in the body, white blood cell count, heart rate variability. All right, this is not a new case, but last thing I want to say here, because we're just about done, is remember there were panic attacks and palpitations and vertigo and lightheadedness and out-of-body feelings? What about all that? I want to talk about that for one last thing, and then we'll talk about diet real quick. We'll be done. You also have your inner ear. The inner ear is a gravity management system that's keeping track of whether you're upright or down or left or right. And when you go on a roller coaster, it throws off your inner ear. Some people have a very, very sensitive inner ear and don't even realize how sensitive it is. And that will throw off your relationship to gravity. In fact, if it's too sensitive, people can literally feel like they're out of their body. They can get panic attacks. They can feel like they're in weird situations. They don't even know where they are. Some people would say, "Oh my God, is this like, are you schizophrenic?" When in fact, actually, it's your inner ear completely thrown off. You might have a little stone rattling around in your inner ear. And we can look for this with something called nystagmus, where we do need to look for these things. But very often, doctors don't look for nystagmus. That might be freaky if you watch it for too long. It's your eyes are moving around because the inner ear can't keep track of it. You're literally disoriented in relation to the force of gravity itself. And so we actually can fix that with something called the Epley maneuver, which you can learn more about, and I write about it in the book. All right, last thing I want to say, and I know we're just about out of time here, but this is the last bit, is serotonin. And serotonin also is dysregulated in EDS, in POTS, and in IBS. What does serotonin do? And why does it have anything to do with gravity? Most people, when they think of serotonin, they think of a mood chemical, a happy chemical, something that makes you feel happy, up, elevated. Think about the language that we're using. But actually, almost all the serotonin in your body comes from your gut, comes from your diet. You have to eat tryptophan, which is an amino acid that when it gets into your intestines, in the presence of bacteria, is converted into serotonin. And then serotonin hitches a ride on platelets, goes into the blood vessels, and distributes all around your body. Without serotonin, you would not be able to pay attention to this lecture because you would be a flaccid sack on the ground, unable to get up like a little baby. A little baby, by the way, who has almost no serotonin in their body because they have not yet colonized their gut. It is vital for gravity management. It helps your heart contract. It helps your blood vessels contract. It helps your muscles contract. The baroreceptor system I described earlier depends upon it. Your inner ear depends upon it. Your intestines heavily depend upon it. We need serotonin in our body to literally stand up to the force of gravity and to feel good. And so the last thing I'll add here is, this is partly, and I want to hear from Kate here, a dietary thing. So making sure that you eat enough foods with serotonin in it, that has salmon, turkey. I call this stack 10: avocado, chicken, chickpeas, kidney beans, tofu, eggs, nuts. These foods are all known to have tryptophan in it, and a nice balanced stack 10 diet can help boost naturally the serotonin levels in your body, in addition to other ways that we can boost serotonin. So I want Kate, if you have a few thoughts about this particular diet or just tryptophan in general, what are your thoughts about that?
Yeah. Well, tryptophan's an essential amino acid, so we have to eat it. It's not something our body can convert. We can have non-essential amino acids that our body can create, but tryptophan is essential, so we need to eat it through our diet. And we've got great sources here in the Stack 10 diet. Seeds are another really great source, and pumpkin seeds in particular. So if you're eating seeds, go for pumpkin seeds. The next top seed is sesame seeds. But I'm a big fan of pumpkin seeds because they're very rich in magnesium too, which is another nutrient that many of us don't get enough of. But it's important that we eat these foods. If you're plant-based, tofu, soybeans, kidney beans, black beans, chickpeas, lentils, there's plenty for all. And just making sure that you have a wide variety because it is important. And, tryptophan is also important for serotonin, but also for melatonin for sleep. And it also helps our body produce niacin too, which is an important vitamin, B vitamin. So yeah, get these foods in your diet, not only for gravity resilience, but also for other functions that are important for our health.
Yeah. Well, that's awesome. I'm going to end there. Just going to say, by the way, serotonin also is naturally boosted with exercise, with sunlight, with sleep, with flotation therapy, which is a great anti-gravity therapy, amazing. With vagus nerve stimulation. The vagus nerve is like a spigot. If you turn it on, it releases serotonin in the gut and the brain. I want to end there. We can't just, change Earth's gravitational field, but we can change our relationship to gravity. And you can actually discover your gravitype. There are 8 different gravitypes. And in the book, I describe this. And this is a little QR code. You can take a gravitype quiz. You don't have to put in any information about yourself. And there's, you don't have to pay anything. It just will give you a little report about which of the 8 gravitypes you're in and what to do about it. And it really is an example of a report. So maybe you're the steadfast bearer, maybe you're the gravity master, maybe you're the alert stabilizer. That's what I am. And it'll tell you all sorts of information about how you can better change your relationship to gravity. So I'll end there. This was the original paper I wrote, Gravity in the Gut, in the American Journal of Gastroenterology a few years ago. And here's more information about the book, which summarizes all the stuff we've been talking about today. So I hope that's kind of useful. I know we kind of pushed it to the end here, but I'm happy to hang around if people have questions or other comments that our panelists want to make. Thanks so much.
Thank you, Dr. Spiegel, for a really enlightening conversation about gravity, and for Kate and Dr. Riehl for speaking about how your particular areas of expertise bring it in. I think patients probably want to know great ideas about gravity. How can they apply it to themselves? Can we just go around and ask you, Dr. Spiegel, how can they have a conversation with their doctor about some of these things, and Dr. Riehl as well, and Kate as well? How can you bring diet in? How can you bring in, GI psychology? So go ahead, Dr. Spiegel.
Yeah, I mean, I tried to give some examples of practical things you can do, whether it's tilt table or inverted yoga or dead hangs or, boosting serotonin levels through vagus nerve stimulation, exercise, diet. And in the book, I go through extensive examples of ways that you can change your relationship to gravity physically and mentally and neurologically. And a lot of it is what we've talked about, whether it's strengthening the abdomen for bloating in the back, standing up straight using a standing desk. The list goes on and on of different ways that you can rethink very inexpensively and practically your relationship to this planet. And a lot of it in the end has to do with how you're mentally processing your relationship to gravity, which is why Megan's work is so important. But yeah, those are just some general thoughts that I have. And the quiz that I have goes in a lot more detail, which is nice for like specific things that you can do. In terms of telling your doctor about this, when I explain this to doctors, they get it. This is no mystery to them. And when I explain it to patients, they seem to get it too. And it sort of changes the reason for, let's say, weight loss or strengthening, or, when you think about it through this very fundamental force, it changes the way you think about your body. But I'll defer to my colleagues here.
From a mental health perspective, I think the more you learn about how everything is connected, the better. I think Dr. Spiegel has shared some really thoughtful and interesting ways of how food can impact the body, our behaviors can impact the body, and impact our physiological as well as our mental health conditions. And so I've put into the Q&A a couple ways to find a GI psychologist if you're starting to connect some dots and are looking for reputable sources. There's gipsychology.com, and the Rome Foundation has a searchable database of trained GI psychologists. And I think it's also just important that, if maybe your mental health, your general mental health is the thing that is a predominant concern for you, it may be important to work with a general mental health provider or a trauma-informed mental health provider or an eating disorder expert first before finding somebody like myself who's going to hone in so specifically on the GI conditions. But don't be afraid to bring this up. Your provider may have a reputable couple of clinicians that they refer to, or you can utilize some of the resources. And just a plug for the Gut Health Podcast. We talk about lots of this stuff in many of our episodes to help kind of keep your awareness and insights around the importance of diet, behavioral, mental health, emotional health in general.
Yeah, there's just so much here. I think, the hypermobility piece is really important. And I think that working in IBS, we probably are seeing this a lot more, and practitioners need to be more well-versed in testing for hypermobility. But as a patient, addressing that with your clinician, like, I watched this webinar and wow, that seems like me. I think my sack of potatoes is really falling far into my cavity, and everything the doctor said on the webinar rang true. I think that there's a lot of people, particularly in my patient caseload, that a lot of this will be like aha moments, and these are questions to ask about joint hypermobility, POTS, getting up, feeling lightheaded, that dizziness. We see that a lot in patients. And then, when it comes into the, in my practice, I think, we need the GI psychologist. We need even the pelvic floor physical therapist to do some of these breathing techniques. They are the ones that tend to do a lot of them. I know the GI psychologists do as well. And then from a diet standpoint, really realizing that those gut microbes play a big role in so much. And we see them altered in IBS, for instance. But, as you mentioned, they play a big role in serotonin production. And so, just working on a balanced, liberal diet with lots of plants, legumes, if you tolerate them, and really, fermented foods, really getting that like good basics of what we understand for good gut health, getting those tenets in your diet, and then working with a GI dietitian to kind of parcel out what works for you and maybe what doesn't work for you. But I think, you need a team, and I'm like the gravity. I hate roller coasters. I have heights. I have dizziness getting up. I'm like, every time you present, I'm like, that's me. Everything you said is me. So I'm not.
It's me too. No, it's when I read the book, actually, I said, oh my God, somebody actually wrote a book about me. I mean, so yeah, I guess that's why we're here. Erica Dermer is here with us this evening, and she's going to ask some of the questions that we've got that some people wrote in. So Erica, go ahead. And there you go.
Yeah, thanks so much. Personally, as someone with Ehlers-Danlos that I've had since I was a baby, it's really interesting to hear everyone's perspective on that with IBS. And as someone also who has gone through menopause, it's a really interesting question about hormones and how that is all part of this adventure as well and gravity. Is that part of it? How does that play in? How does the change of life, so to say, for women and for men also affect their relationship with gravity?
Yeah, that's an interesting question. Yeah, I think that's, hormones, of course, there's so many different hormones and they all have different effects throughout the body. Clearly, for example, hormones can affect your body mass distribution, your tissue stiffness versus how compliant your tissues are, the fluid balance across your body, muscle tone, postural reflexes. All of these things can be affected by hormones, whether we're talking about cortisol levels or, estrogen. Obviously, with menopause, estrogen can drop. This can reduce bone mass, which leads to less structural resistance to gravity. The fascia, or the spaces in between the organs, can stiffen, which can reduce shock absorption, which is very important. There's something called tensegrity, or tensile integrity of the body, which is how well can you bend without breaking, basically. And as the stiffer you get, the harder it is to manage gravity, which is why yoga and these sorts of pliant therapies are so effective. And so I can go on and on about each individual hormone and how it can affect a thyroid hormone, you name it. But that's a really good question that goes really deep and broad.
I just have a question for you, Dr. Spiegel, when you're speaking about serotonin. So serotonin was early on involved in managing IBS. The first medication that was
Yeah.
approved by the FDA, decreased the amount of serotonin, which helped people with diarrhea.
Yep.
And then the next one that came out increased the amount of serotonin for people who had constipation. So I don't want people to walk away thinking, hey, let's add more serotonin when they have,
Yeah.
diarrhea predominant IBS. Can you talk a little bit more about that? And why do you think we have this regulation that needs to happen with serotonin?
Yeah, so it's very complicated because serotonin itself is not all that complicated of a molecule, but there are many, many different receptors that it plugs into throughout the body. And this is where it becomes what we call pleiotropic. So it has so many different functions in the body. Sometimes you can have too much or too little. It goes both ways. So in the gut, you're right, when we have a lot of serotonin, too much serotonin, it can lead to rapid transit of the intestines. Whereas the opposite can happen if you have low serotonin, it slows down, everything becomes, kind of stagnant. And so in each individual person, there is a unique relationship between the diet that you eat, the microbiome that you have, and your ability to generate serotonin in the intrachromaffin cells in your gut that determine your unique serotonin profile. And we don't have enough science yet to really figure out genetically, epigenetically, what is the exact best therapy for each individual person. But I will say you're right that it's not straightforward. It's not like, you want lots of serotonin all the time. But I will say if you feel sluggish, brain fog, exhausted, depressed, slow, you may have a low serotonin problem. That much may be clear. But yeah, it's complicated. And I'm sure have some experts here could talk a lot about that.
Erica, why don't we ask one last question because we've kept everybody pretty late tonight, so I appreciate it.
Yeah, fantastic questions. Fantastic conversation. The last one for Kate. I know that we mentioned talking about tryptophan in the diet. What about supplementation for something like that? I know that you're talking about natural. What about supplementation?
I mean, I think there's such a wide variety of food. I'm a food first person. And I know there was an incident with tryptophan. I remember when I was working in the hospital where a patient was in the ICU for a tryptophan supplement, and I'm not quite sure the backstory on that, but I don't see a real need when you can get there's such a variety of different foods. If unless, you couldn't eat any of those foods, I guess, we revert to supplements, but I don't know of any supplement and I've never tried one with a patient.
Dr. Riehl, any last words before we end?
No, I think we have to be open to considering lots of different new theories and following the science with everything. I think, I've had the pleasure of having some conversations with Dr. Spiegel now about this. We just have to be aware that sometimes understanding what's going on with your body from a different perspective can open up new opportunities for you. So thanks for including me in this conversation today.
No, you're absolutely right, Dr. Spiegel. Thank you. I mean, I remember when you came to us at an ACG meeting and you said, I have a theory, and then you told us it was gravity, and we said, okay, and you gave us a number of examples, and then you wrote your paper, and we read your paper, and we thought, okay, oh, I get it. Wow, this is really fascinating. So thank you for, having this conversation and opening up this whole new topic of conversation around how gravity may be involved in IBS or even just managing your body. So thank you. Thank you all of you for tonight. Thank you to our viewers for tonight. We hope to see you again in 2026 when we have some more webinars. We'll be sending a link to the recording for tonight to everybody who registered. So thank you for that. And I just want to wish everybody a very happy holiday and happy Hanukkah to those who are celebrating now. And thank you and have a good evening. Thanks.